Good morning, I'm Adam Sexton. She was against the Republican health care bill in the U.S. House and is against the one being discussed in the Senate. On one hand, she's in the midst of a massive Democratic resistance, but is there still room to work with President Donald Trump? Representative Annie Kuster is with us today on Close Up. Thanks for being here.
Great to be with you, Adam. Thanks for having me back.
So you've been there in Washington long enough now to kind of get the lay of the land. Does Mitch McConnell have the ability to turn this around for the Republicans and actually pass this health care bill in the Senate, do you believe?
Well, look, the vote got delayed in the Senate this week, and now they head home for a 10-day recess over the holidays and a work session at home in the district. I think those senators are going to go home all across the country to thousands of people turning out, talking about 23 million people potentially losing their health care coverage, particularly in the states like New Hampshire, but also Ohio, West Virginia, where they're hit hard by the opioid crisis. We know that there's a lot of consternation about what's going to happen to these people. Right here in New Hampshire, you look at a program that's been so successful, like the Safe Stations program, finally people getting access to the treatment that they need for their opioid addiction, and all of that could be lost if we lose the 23 million people off of Medicaid and off of their health insurance. So I think Mitch McConnell's got a tough uphill battle.
Yeah, the Medicaid reimbursements to hospitals alone, we were talking to representatives from Chad. They think they might have to close their doors for their children's hospital just based on that, the $1.5 billion over the next decade or so. That's catastrophic.
It's a heartbreak for New Hampshire, Adam. The Children's Hospital at Dartmouth is really a gem for us to have in a rural state, to have that level of tertiary care for our children who are sick. I'm very focused on these babies that are being born to moms with opioid addiction and this neonatal abstinence syndrome. It's essentially babies born addicted to heroin. And we have great programs now. We have actually extraordinary programs to get these moms into prenatal care, get them the help that they need to get off the drugs, and make sure that the babies get a great start and are healthy and headed on to be productive citizens. So I look at this as a public health crisis. This is not just a handful of people in New Hampshire. Everyone knows somebody. I talk to employers whose lives have been impacted by their employees and their family members. This is something, as the governor used to say, we need all hands on deck. And the last thing we need to do is lose that coverage, because good hospitals across the state will be forced to close down programs. I'm very worried about our rural hospitals, and I'm particularly worried because we're trying to grow access to opioid care, not lose facilities.
Mm-hmm. And certainly the House has done its process, but did the Republicans ever reach out at all? I mean, it seemed like they had a debate among themselves. Was there ever any effort to bring Democrats in to say, how can we get you to support some changes to the ACA?
You know, this is the shame of what's wrong in Washington, D.C., and I hear about it every time I'm home. People here in New Hampshire want us to work together. Let me tell you that I'm part of a very small group of people that are trying to come together behind the scenes to come up with some solutions. We know that we've got some problems in the individual market, and we've got to stabilize that market so I don't continue to hear stories of, you know, people in business for themselves paying $35,000 a year for premiums. That's unsustainable. So we also need to bring as many people into the healthcare markets as we can, and we've got to help particularly young people. I'm looking at people in their 30s. I just heard yesterday that we are at the lowest birth rate ever, and I'm worried it's because these millennials don't feel they can afford to have children. So we've got to do better than that. That's our future. Then I think that we can bring down costs. One of the big areas that should be bipartisan is to bring down the cost of prescription medication and make sure that the government gets a volume discount. Medicare Part B, we should be getting a volume discount for our prescription medication. So look, there are lots of things that we can do to make this better, but they've got to stop talking about the repeal in the Senate and then give us a chance to sit down and talk together. Let's come up with something that works for everyone. You know, that's the way the legislative process should work, and part of the reason that Mitch McConnell is having so much difficulty is he only has 52 votes to start with. He's insisting on getting it all done within the Republican caucus, and he can only afford to lose a couple of votes.
And if that bill changes substantively, doesn't the House have to vote again because it's part of the reconciliation? How does that work?
Well, so what happens, this is sort of basic civics here, right? But the House passed a bill. I thought it was a terrible bill. Under that, 26 million people would lose their health insurance. I voted no. It went over to the Senate. If the Senate can get to 51 votes, they send it back and the House would have to vote again. And if they can't come to an agreement, then there won't be any legislation and we're back to ground zero. And I think at that point, that's when Republicans and Democrats should sit down at the table. Some of these ideas that I've just mentioned, they're bipartisan. We can get the traction to get it done. And, you know, let's make healthcare work for the American people, small business owners, people who buy their own health insurance, as well as people who are employed and have health insurance through their work.
You touched on the opioid crisis. Last week, you were part of a major announcement coming out of Dartmouth that they've finally been able to scientifically confirm this nexus between mental health issues and addiction. What does that mean? What are the implications for that finding?
So a couple of things coming out of that study, and let me just step back. The Center for Disease Control has done studies to show that 4 out of 5 people using heroin have a co-occurring mental health issue. We talk all the time with people in recovery, and I've heard so much about anxiety, depression, but also trauma. I'm on the Veterans Affairs Committee. I work with the veterans. We've got veterans coming home with PTSD or military sexual trauma if they've been sexually assaulted, domestic violence victims, people that have had difficulties in their life that now they take this medication and suddenly they feel well, they feel better. And so what we need to do is tackle how to get those people the mental health treatment that they need. Maybe it is an antidepressant, maybe there is an anti-anxiety medication, but not turning to street drugs or worse yet, heroin and fentanyl that are so dangerous. So this study last week from Dartmouth was fascinating. What it showed is that people with mental health conditions are actually being prescribed twice the opioid medication as the rest of the population.
Which is gasoline on the fire.
And we had recently learned that in New Hampshire, generally, people in New Hampshire are being prescribed twice the national average of opioid prescription. So we've got to keep rolling this back. We've got to meet with our physicians, talk with them, do the research, and so that they understand. Let's use alternative pain management techniques. We have a great research going on at the VA up at White River Junction with our veterans to give them acupuncture, mental health, physical health, different types of wellness and treatments, yoga perhaps, that will help them deal with the pain from their injuries, but half the rate of opiate prescriptions. And let me tell you, I've met with these folks. They feel better. Their lives are better. And so that's where I'm very focused. And part of the legislation that we rolled out in our agenda this week with our bipartisan task force to combat the heroin epidemic was to tackle just that. Let's do the research. Let's find out what works. And then we can take it from the VA out into the civilian healthcare delivery system and educate our providers about some alternative pain techniques.
A little shift in gears here. President Trump's tweets about MSNBC host Mika Brzezinski last week. This brought about almost universal condemnation from there on Capitol Hill.
Bipartisan condemnation.
What do your Republican colleagues say about the president when the cameras are not around? What are they saying? Are they standing with him on this kind of stuff?
No, they're equally mortified. I have to say, Susan Collins, Republican senator from Maine, came out very strongly on this. Look, I think it's such a distraction. It's unbecoming of the office of the presidency. And frankly, I think some people are starting to be concerned about his capacity and fitness for the office. So when I talk to my Republican colleagues, they're very, it goes beyond disappointed. I think they're becoming ashamed by This is an office of stature. The presidency of the United States of America, all over the globe, people look up to this office and to the person holding the office. And just in 6 short months, we're losing so much ground. And, you know, take the phone away. I mean, that's basically what they're saying, is how come there isn't someone who can intervene and, you know, treat the office with the dignity and respect that the American people expect and deserve.
Your district was kind of fertile ground for President Trump. You know, it was surprisingly so in 2016. Does that change anything you do looking towards 2018 in terms of like a city like Claremont, which actually voted by a small margin for President Trump? Does that change how you approach things heading into re-election potentially next year?
Well, you know, Adam, I always say I'm born bipartisan, and I suit the district well in that way. It's been a swing district. I am actually the first Democrat ever to win a 3rd term in this congressional seat. It's never happened since the seat was created back in the 1850s. So it doesn't change my thinking. I know that there are Republicans, Democrats, and independents. I represent them all, and I want to hear from everyone, all sides. It impacts the way I view the world and what I think about. You don't find me being a just, you know, marching in step Democrat. I will, that's why I've created a bipartisan task force on heroin. I just created a brand new bipartisan task force on sexual violence. I work across the aisle. I'm fortunate the committees that I work on, Veterans Affairs and Agriculture, which suit the district well, also happen to be 2 of the only bipartisan committees on Capitol Hill. Later this summer, I'll be going out to Michigan for a hearing with my bipartisan co-chair of the Oversight Committee. So I always work across the aisle and hope that I represent everyone.
All right. Congresswoman Ann McClain Custer, thanks for joining us. Have a happy 4th.
And congratulations. You're doing a great job.
Thank you so much.